name is Dr. Nanditha Arun. I'm from Chennai, Dr. A. Ramchandran's Diabetes Hospitals. And it is a great honor and a pleasure for me to be talking about women with type 2 diabetes and their cardiovascular risk at the RSSDI 2021 this year. As we all know, the burden of type 2 diabetes is increasing in alarming numbers globally and in our part of the world, especially in India. And recent data from the STRIDE study that we conducted in southern India shows that there is in fact an increasing number in people living with not just type 2 diabetes, but also pre-diabetes. So this is an important point because these are people who are waiting to convert to diabetes. We also found that there is an increase in the cardiovascular risk factors, namely hypertension, dyslipidemia, and obesity, including abdominal obesity in over the past 10 years. In the study, we interestingly found what was more concerning was that women had a higher significant increase in the percentage of not just dyslipidemia, hypertension, and as I mentioned earlier, waist circumference and overall obesity was significantly higher in women. And what was more disturbing was that this is not just in the urban areas, but also more so in the rural areas. Now, this is something very, very disturbing and something that we should be concerned about because, as we all know, access to healthcare itself is something which is a point of concern, especially to rural areas, and of course, lack of awareness and poor resources in the rural areas is always something that we have to keep in mind. So this burden that we have with type 2 diabetes, cardiovascular risk factors, including dyslipidemia, obesity, and hypertension is increasing, not just in men and also in women. More so, women are at increased risk of cardiovascular disease. There is enough data to show that when women are diagnosed with type 2 diabetes, their so-called estrogen production, which a woman has, the premenopausal woman has, is actually lost. And her cardiovascular risk is equal to that of a postmenopausal woman. So that being said, I think I would like to thank the organizers for giving me this opportunity to address this issue. And I would like to thank Dr. Bansi Sabu, the President RSSDI, and the entire RSSDI team and congratulate them on this amazing conference this year. Thank you.